So thank you to our sponsors for sponsoring our events. If you're interested in becoming a sponsor, please contact Hazel Chappell, our Vice President of Sponsorship. And without further ado, that's our announcements for opening this wonderful Lunch and Learn. My name is Hope Young, and I am the Vice President of Programming for our HIMSS Austin chapter. And we are very excited this month to have Brandon Elliott. Brandon is going to be speaking today about the personalized healthcare journey, HIT-based care, where we are and where we are going. Brandon specializes, he's the client executive with Insight Corp, and he specializes in transforming businesses through technologies. He is customer-centric, results-driven, and operationally minded expert with over 30 years of award-winning experience in engineering, development, and management. Brandon, we're very excited to have you, and without further ado, welcome.
Thank you. Thank you. Really great to be here, Hope, and thank you for your time. I wish we were together and having lunch and learning together in person, but it is what it is. So thank you for taking some time. And as we've really prepared for this lunch and learn, we've taken some time, and I've tried to pull together some, I think, useful data points and examples of innovation and transformation that we're seeing in the industry and in the world, and even in other industries like adjacent industries. So just so you know, I put together these topics, this agenda that we'll kind of follow loosely. Feel free to ask any questions in the chat. We'll try to be dynamic. If you have a particular item that you want me to dive in on further, we can, and we can skip around a little too. So this is intended to be a good interactive session, and I want to really provide any insight or learnings that we've gained across 30 years plus in industry. So we'll kind of loosely follow this agenda, if that works. So a little bit more too, so you understand about where I'm coming from. I actually started at Build-A-Bear Workshop and was there for the beginning of the interactive retail age, if you will, and started creating personalization and customized data platforms with unique experience. So when we talk about personalization and experience of the patient, and even the operations of your people and your staff, something I hold true to heart. And so, you know, it's not really just for technology's sake. It is all about the experience and about the outcomes that you drive to, right? So one thing I wanted to bring up, I know there's a couple of slides here just about our current state of affairs, State of the Union. And boy, are we in an interesting and challenging climate right now for healthcare, right? If you look at it here, these are things that you're living with day to day, right? In terms of just the types of things that COVID has done, not only has it ushered in transformation, but it's also greatly impacted your ability to do some of those more profitable services. You know, that's caused some crunch on your budgets. And even worse than that, you now have burnout from a lot of your healthcare professionals. And so, you know, one of your biggest challenges is going to be, how do you retain talent and even attract talent and enable them to spend more time in front of patients versus managing, you know, the data systems that are in play. You know, we do know that by 2030, there'll be a massive shortage of healthcare providers and workers. So we're really going to be in a crunch, right? So I think some of the innovation topics we'll talk about here in a minute, we'll have some ideas of maybe how we address some of those things, but it certainly is a concern. And, you know, even further, that the 41% of providers say that data and analytics is a challenge, right? There's so much data out there. You know, hospitals have more rich data than any other place that I can think of, based upon all the data that you're gathering, whether it's blood samples, heartbeat monitors. You know, if you think about all of the data that's generated, there's a lot there. And being able to use that data, aggregate it, and derive useful outcomes, I think is going to be a pretty important thing that we do in the future. So this is, of course, your world, right? Further, I think of all industries that we're tracking, you're going to see that healthcare will be disrupted very heavily, right? And you ask why healthcare? Well, it's really the only business that's big enough with enough scale and potential for these big players to pay attention. It accounts for 17% of the US GDP, which is not small, right? And if you think about it, I don't know if you've all are familiar with the net promoter scores, but basically it's a survey that when, customers would fill out that would rank the experience if it was good or not. And you'll see that healthcare is actually in last place. So it's ripe for new experience, better, just a better overall experience, right? For disruption. So you're going to see that it's ripe for that. And I think you'll see really physician clinical services and just prescription drugs. That's a big chunk of that opportunity. And so the reason I'm showing this isn't to say, oh my goodness, we're going to be disrupted. It's really more for you to be aware, and you probably already know, but how do you disrupt yourselves? And it's very hard as an innovation consultant. I observe it's hard for people when they're in the mode of running a business to do innovation. And so that is definitely going to be something you'll want to be aware of and spend time in thinking about. How do you disrupt yourselves, or you will be disrupted? Think of, Uber's the old example, right? Uber and taxis, Airbnb and hotels. Well, what's that going to look like in the healthcare industry? I think, the next 5 years, you're likely to see probably one of the largest transfers of wealth from the incumbent players to these new players. And we'll talk about that a little later. Some of the big ones, let's just talk about them, right? So as you know, you probably saw Amazon's in the game, and they've been doing it for a little while, but it's heating up. And that 82% of households that have Prime accounts. So they already have a hook into the user experience, the single click purchase, and the financial side of the world, and also the distribution. So if you think about it, they're primed to be able to go after a couple of those big segments, right? And if you looked at the news when they announced that they were getting into the business, right, back in 2018 when they purchased PillPack, that day the market bumped them 20 billion in market share when the competitors hit a negative 11 billion. I mean, it's a massive shift. When they move big, right? And it's even more interesting too, is they've gone into the home with Alexa. They're actually able to, and they filed a patent to do this, where they can listen for coughs or listen for hacks and predict, hey, these guys might need, hey, can we send you some Robitussin, right? Or so it's gonna be very interesting to hear how that's gonna work in your own home, right? That personalized healthcare that's proactive, and then how they distribute it right to your door. Apple, I'm on an Apple computer here, but it's funny, if you look at the future of Apple, it's probably not going to be in their laptops and desktops. It's going to be in wearables and mobile. And we already know that from the iPhone. The Apple Watch is just amazing in the success that they've had. If you look at just in 2019, they made 4 times more than Netflix in total just selling Apple Watches. I've got one, and when they came out with the ability to monitor with an EKG, it's still a little cumbersome, but works pretty well, right? That used to be something that you'd have to spend a lot of time and money to go have done, and it's now on your wrist. And even further, if you look at what the patents that they're filing, temperature, I think, is next. The picture right there below the Apple Watch, they've actually filed a patent to embed temperature sensors into either the iPod Pros or the Air Pros, or in the watch band of your Apple Watch. And who knows, that technology, I think we're going to find it'll start to just become part of what we wear, and in our clothing and our shoes, and all of these data points and IoT sensors will be able to send data to an aggregation point and start to provide personalized healthcare. So that type of consumer, direct-to-consumer focus is going to be disruptive, right? And of course, the convenience factor, you'll see here, there's quite a few players that have locations right near people's homes, and they're going to make a play for it. If you haven't seen some of these pop-ups, little quick care centers around, then you're not paying attention. And I think it's going to get even more and more prevalent, and it'll be interesting to see how the players come out. But that's also going to be competition too, right? For some of the basic care services that you'll have. All right. It's interesting, really trying to feel your pain right now. This is a hard moment, especially with COVID going on, and the ratio for doctors to patients. It's very, 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 very low, and even more if you look at worldwide. It's even worse, right? They're at 1.5 per 1,000 people. So there is a shortage of talent, and so using technology and data and AI, I think, is an interesting approach to how to help with some of these diagnoses in the future. We do know that our healthcare workers, primary care workers, spend way too much time on EHR and the systems, and it's interesting. I think if you're at the HIMSS conference this week, there's a session or two. I think they've got a panel set up where you can hear about, is that technology helping or hurting? Something that used to take seconds now might be harder and longer if your information systems aren't user friendly and with that design thinking in mind. So how do we, as information specialists, make it so that it's actually enabling and helpful and proactive, and not something that takes them away from the patient, but still gathers that quality of information that we need to provide the healthcare, right? And then really just protecting the people when they're in the hospital, and healthcare workers. How do we measure, monitor, and provide a good, safe environment? I think there's a lot of opportunity here for us, right? And technology platforms can either be a blocker or an enabler, right? And so getting really into the scenario where you're optimizing and reducing the patient length of stay using quality of care and machine learning, helping provide these platforms that allow a patient focus versus a burdening of the admin. Optimizing your clinical staffing, I think is a pretty big part of this, right? Using predictive analysis, how can you use that data based upon the patients that you're seeing, the type of trends that are going on in your staffing, so that you can optimize your beds and your staff to help it. And then really, nurses and physicians, they're burnt out. We know that. You'll hear panels on that as well over the HIMSS conference. So pay attention to that, and maybe share ideas if you've got some. I know there's some pretty interesting and good ones coming out, but it's definitely not an easy one, right? One thing I did want to share, this use case that I think was very, very beneficial and helpful. So my company Insight, we have a data and AI practice. That team was able to engage with Stewart Healthcare. You may know them. They're a 38 hospital system out in the East. We basically engaged and helped to predict for every admitted person by diagnosis code up to 3 weeks in advance with a 98% accuracy, which basically allowed them to optimize clinical staffing and bed optimization. We were able to predictively reduce their length of stay by 1.5 days, which improved overall profitability and, of course, patient outcomes. I think it saved them about $125 million over 6 years. So not small, right? And that was just this one use case. It's interesting too, this is a continuously learning healthcare system. It's not that was accomplished on day one. These machine learning models, as you learn and grow, become better and better, right? So being able to get to a 98% accuracy of prediction of patient loadout from loadout a week out at a time took some time. And it's interesting, just as a little side note, you may not actually understand how important it is when you check in with your driver's license. It was interesting. We learned, based on data science, the #1 predictor of determining length of stay when someone checked in is, did they present a driver's license or not? Now, we could probably talk 30 minutes on why and how and the implications there, but interesting, right? You would never have guessed that. And so the idea then is, how do you use these models to reduce costs and optimize your operations? Just wanted to throw out too, I think Google is going to be a big player for us in terms of this continual health learning system. They also worked on a model where within a 95% confidence during their stay, they could predict if your likelihood to die or if you're going to make it out, and what your likelihood would be to return within 30 days. Can you imagine if you could determine that for every one of your patients? Are they going to be back here in 30 days? I mean, not only would you maybe change the way you do healthcare, but it may also help you staff and predict future needs even more. So statistically, there's very significant things going on now in healthcare using machine learning and data and AI. So speaking of data, this whole notion of data, we're going to have to get really good at it. And I know you all know this, you all live in data, but you've kind of gone from this data as a necessity to now data as an interoperability capability. And if you want to be relevant in the future, you're going to have to figure out how to digitize your data, make it electronic, protect it, make it secure, do all those things, but also make it so that you can share and interop with other systems. And one standard that if you haven't heard of it, I want to be sure you heard it here, is the FEAR standard. It's a ISO 7 group. It's open capability. Basically, this API, an advanced programming interface, allows you, if you follow these standards, to easily share data as appropriate across platforms. And it's interesting, as I was just looking at Google and looking at news and healthcare, this is a hot item. If you look here, the GE even just announced yesterday, this is Monday, that they're going to collaborate with AWS and start building these systems. So you're seeing this massive investment of data and interoperability. So, if you think about it, you generate petabytes and petabytes of data. Not much of it gets used. So what's the future going to be like for you to be able to work with that data, standardize the data, make it available appropriately to your partners, right? To your ecosystem. So that's a big one. So personalized healthcare journey, right? We're talking about different things that we can do with the patient and how you empower your teams. We're seeing, these are some of the topics and use cases that we're seeing quite a bit of movement in around the globe. And so, just wanted to make sure that we knew a couple of these topics, right? I think I've got a couple of use cases in here. I'll tell you, for example, what I hope for in my future is my data in a repository that's secure and that's me, all of my health data. And I want an AI to kind of help me. This is what you should eat. This is what you should sleep. How long you should sleep. This is, the types of things you should go do to be proactive and preventative versus, being more of a sick care scenario where you have to get sick first. And so we'll find that. We're also seeing, the experience when you come onto a campus. How do you help people find where they need to go? How do you help connect those experiences, make them more engaging? A little more of a navigation experience, a little more immersive as well, right? So digging in here, right? How do you create those personal health assistants? Telehealth is a topic I know, so that you can provide healthcare wherever they are. They don't have to necessarily come in. So those connected health experiences, that whole journey mapping of, when they find a need or even before they find a need, what does that look like to simplify that? It's kind of the Amazon model. Their whole model was customer experience first, and they embedded everything. Like now, how hard is it to go spend a lot of money? It's a single click, right? Imagine that applied to healthcare. If you don't think they're going to try, then you're going to be surprised, but perhaps that's probably where Amazon's going. Imagine that for healthcare. So how are you going to participate in that future world that consumers expect nowadays? They expect that type of experience, right? And so AI for precision medicine as well. I think hate to say it, but we're still kind of in the dark ages when it comes to medicine and prescriptions. You go to any of the health stores that are selling vitamins and other things, and it's these wide swaths of over 50, if you're sports, if you're and so okay, that's nice, but really, what does my body need? And so what would an AI algorithm recommend for me, not only for medicine, but for nutrition and for health? And really combining all of these data sets so that you get statistically significant outcomes and advanced analytics so that you can then build models that are meaningful, right? One good example is in the genomic world, right? 23andMe, if you guys have done that, their data now is getting so rich and deep that they're getting quite good at predicting things that you would never intuit based upon, your taste and your hair and your height and your genome and, all these things they can aggregate and have some type of, oh, well, you're 60% more likely to get cancer. I mean, it's crazy what you can come up with once you have the data in a place where you can use it, right? And then really, how do we help simplify the healthcare experience for these chronic diseases? We're just really not very good at proactively managing these types of chronic care things that we could if we wanted to. As an example, I'll just go to here. Actually, let me skip to this one. Sorry, guys. So personalized health assistant, I talked about this one. One thing that we did help imagine and build is this personal AI assistant that talks a lot about your personalized experience. And what's nice about this is it helps using your data set, using your what you're eating, your nutrition, and recommends a better way forward. And you've probably all used these flat chat agents that just aren't very engaging. This is not that. This actually has sentiment analysis. It has machine learning built into the back end, so that it actually starts to build a model that's meaningful and conducive to your your life, your medical needs, and what your goals are, right? So a couple of things here. I wanted to talk a little bit about innovations. This is actually my passion area, and I've been going to kind of a trade show junkie. I've been going to look for innovation in any industry and try to innovate the adjacent possible, right? What I'm seeing for healthcare is that you're starting to see information technologists really dive in, and because of that disruption potential, there's all kinds of startups going on right now. You'll probably see a bunch at the trade show or at the event this week. You're seeing a bunch all over the world, and even myself. So I'm on a bit of a personal journey with my own personal data. I'll share a little more about that in a minute. But all of these types of devices now are being pushed down. This little Zeo that you're seeing here, I actually wore one for a couple of weeks, and it was a 24/7. Monitored my heart rate over 1.5 million beats to make sure when I was sleeping, and to really see if there was any type of issues with my heart. And so these will become a little bit more of a commonplace as they scale out. The little ring there, the O2 ring. So my father, he's on oxygen. He's used to using little finger clampons. Well, I got this little ring, $150, and he can wear it 24/7. And what's interesting is it's actually streaming his O2 level every second to his smartphone, and I get alerts. Like if he's asleep and his O2 level drops, I can be alerted. So it's pretty amazing what you can do with these types of personal wearables. Even more fun is I've had some really good conversations with my own dad, looking at his data over time. Like I'll map it out and I'll say, hey, did you notice that when you're sleeping at 2 o'clock in the morning, this is what you're doing? And it's actually adjusted his life so that he is less likely now to have an oxygen drop of some kind. So this is the type of personalization that will be coming soon. Yeah, and I do think the costs of all these things, as Adam mentioned in the chat, as these systems become interconnected and data driven, the costs will come down, and all boats will rise in the harbor, if you've seen that analogy, heard that analogy, because it will become available more, right, and more people doing it. I think right now these Zeo patches, they're about $350. It's not really affordable for everyone, but they'll go down, if more people use them, and as competition comes out. DNA-driven AI, my goodness, is the genomic sector just bursting with innovation, and everything from curing aging potentially all the way down to personal nutrition, personal healthcare, things to avoid, things to do. Genome has come down tremendously in terms of cost. So you're going to find a lot about that DNA-driven healthcare outcomes. We could spend a whole nother hour talking about Internet of Things and connected devices, autonomous equipment, how to manage them, how to maintain them, how to aggregate the data to a data store. IoT is definitely in our future. All of these wearables are basically an Internet of Thing device, and depending on the ecosystem or platform you're in. So I'm sure you're all thinking about IoT and how you're going to enable the edge, right? Even the patient. You think of the ultimate edge. It's the devices that your patient would wear. How do you work with that data? How do you create it so that those data points become interactive and helpful and inform the type of care that you provide and eliminate some of the guesswork, right? Or duplication. Like as an information specialist, it always drives me crazy when I fill out a form and I put my data in that I have to fill out another form with the same data and the same stuff. It's like, why, right? We can do better there. This whole notion of RPA, or robotic process automation, is basically taking some of the drudgery out of the work for everyone, using scripts and development operations and automation pipelines to take some of those forms and pre-fill or just make it easier, right? And get out of that daily grind of some of the operations. I think if this is done right, it can do everything from contract negotiations to check-ins, checkouts, etc. We're seeing a lot of these workflows even flow down to a mobile device and text messages, all the way up to very complex financial systems. So RPA is something you should be looking at. All major clouds have capabilities, as well as there's product you can buy if you want a particular product set. So immersive patient experiences. Boy, I tell you, there is so much going on with these types of immersive technologies. If you're not experimenting with it or aware of it, then maybe you should be. It's certainly for the digital native generation. It's where they play, whether it's on their smartphone or virtual visor. There's things that we can talk about there. And then, of course, all the new sensor tech and things that are coming out. We've already talked about the watches, these Zeo patches and others, but I think I'm looking for a day where there's enough data in real time gathered off of me that I can tell everything: blood, O2, temperature, nutrition, how your gut biome's working, how you're just basically optimize my health and my productivity in the day, optimize for my circadian rhythm, optimize for everything that I need to do. Even this presentation, good news is we're in a pretty good spot in my circadian rhythm. I'm here. If you talk to me about 3:30, I'd be down. Maybe would be a little less excited to be here. But so optimizing even the things that you do in the day using data-driven healthcare tools, right? It could be very interesting. And then gamification, right? I tell you, as soon as people figure out that people like games, it makes it more fun, it takes some of the drudgery out, you're going to see this occur, right? Progressive's doing it with insurance. You get a discount if you use the little monitor, right, in your port on your car. They give you a good discount for driving. Imagine now you get a good discount on your health insurance for good health practices based upon wearables and the data that comes. So some people are on the fence and think that's a little scary. Could be a good way to help, though, with people's health overall, right, and move the ball forward. We go back to the telehealth here, right? We know telehealth is a big part of the future. It's going to continue to grow. So figure out, what type of telehealth system you want to work with and how that fits into your healthcare practices. Like many corporations, COVID really ushered in more transformation in a few months than in years for many companies. At Insight, we provide a lot of hardware and software. Our 500,000 square foot facility was just swamped during COVID, trying to get monitors and screens out the door for people to work remotely. Well, same thing with telehealth here. You saw a massive jump in telehealth due to COVID-19. And while it's come down a little bit, I think it's here to stay. And I think you'll see double-digit growth as well into the future in this space. And one of the reasons that is look at what's happening in the news. Like Walmart, they're going big. In fact, they're these companies that have scale like Walmart, they can take something that's challenging and hard like this and bring the cost down to where it's going to be scalable and deployable, right? And in fact, internally, just imagine how many employees they have that they're going to be able to experiment on, right? To figure out the system before they roll it out to the world. And they're getting it down to where it's like $4 for a telehealth visit and for internal employees. And we'll see how that then rolls out into the world. And literally just look, yet another article from yesterday, Zoom, which was kind of one of the big winners in the pandemic, right? They've just now announced Monday a HIPAA compliant version of a telehealth offering that you don't even need to download the Zoom app for. So all of these platforms, all of these things are coming, and so telehealth is going to be a big player, and figure out how that's going to work for you in your world. And so basically, if you look at the stats, 52% of all patients have had at least one telehealth visit in the last 12 months. Thank you, COVID. 64 of those percent of payers reported an acceleration and adoption of digital health systems coming out of COVID-19. And in financial health, 1 in 10 clinicians see their practices is in a hard and unstable position because of the visiting scenario, where telehealth might help, right? If you could spin up a telehealth capability, you can offset some of that financial challenge, I think, right? So basically, 90% of people expect healthcare costs are going to rise over the next few years. This could be a way to help offset some of that and keep your patients in your program, right? So really just focus on digital health, financial health, and AI and machine learning to help kind of pull together some of these outcomes that we're trying to drive for. All right, so back to some fun stuff. Hopefully I'm going at an okay pace. I want to talk a little bit about immersive technologies, because this is one of those things where it's been nice and it's the shiny thing in the room, but have we seen big adoption yet? And I would say probably not as much as maybe we'd like, but I will say it's coming. And I know for myself and my own family, VR is a big thing. It's here to stay. My kids play on it all the time, and it's going to be what they expect for their digital future. And so so VR, of course, it's a little hard to pull off in healthcare when you're on premise, because it blocks your view, right? Just imagine it's like the Oculus, or I think shown here is the Samsung device in the VR segment. So that's full blockage. Mixed reality gets a lot more interesting. It's where you can actually 3D map the real world and then overlay digital items and actually place them in spatially aware areas. So one of my favorite apps on the HoloLens, for example, is what you see in the top of the mixed reality box there, where you actually can peel back the layers of a person. And I was actually helping one of the Houston hospitals that actually use ultrasound to be able to map the ultrasound real-time data from the scanner over a patient's brain as they were to do surgery on a brain, so that the doctor, instead of kind of guessing and looking up at a monitor like this, they could have the visor over it and have real-time a data overlay over where they were operating. So some really interesting thing that's coming on. Training, of course, is a massive big thing that you're seeing here as well with mixed reality, where you can have more real live simulations going on versus just a more of a static training event. So those are pretty good. And of course, augmented reality, this is like your smart glasses that we'll probably be seeing soon for real in the world. There's some big players that are developing those. Your smartphone, of course, is an AR device. I think we're just now starting to get uses of AR that are going to be practical. We're seeing a lot of that in logistics, right, where you can use a smart device to visualize where something should go or to find something. There's quite a few projects now going on in AR and mixed across these industries, and it'll be interesting to see how healthcare brings that into play as well. So with that said, there's some pretty interesting immersive technology focus areas that we can talk about here based upon what you care about and what your need is. Remote assistance is probably the #1 app that we see for these types of mixed reality visors right now, not just in healthcare, but especially with COVID, where people couldn't fly out to support on-site needs. You just ship out a mixed reality visor, you put it on the person who's there, and they go to the area of need, and you can remotely go in, just like we're talking in this chat, but they see what the person sees and can actually help and be that over-the-shoulder assistant and helper. So we're seeing a lot of that type of activity going on across all industries, healthcare no exception. Of course, visualizing data is a big one. Once you have these data sets, how do you make it real? How do you dig in? How do you pull out and distill the statistically significant data points that are actionable? And so you're going to see a lot of very visual, meaningful data sets. I'll show you one of mine here in just a minute, come out of this 3D space, right? And so what's interesting is we're seeing as well, a lot of things are coming together to allow for this. Mobile devices are becoming more capable to do these things. Usually in the past, you couldn't even render a picture of someone's brain, or you couldn't work with the data sets. Well, now with the graphics processing units and the storage and just the overall speed and compute at the edge, we're being able to do things now that we just never could have thought we could ever do. And that's going to be showing up in your operations, and in your patients, of course, are walking around with a smartphone in their pocket. So, you know, you got a supercomputer in your pocket. And so what are we doing to enable that to become a native experience thing that enhances that journey versus, you know, not having it and having some other static old school legacy way of doing it. Of course, training, I mentioned that already. You know, the ability to train anywhere is super big and important. And the quality of the training is getting better as well. As the rendering becomes better, the workflow that comes in is better. And as the cameras that face out as you're practicing are spatially aware, you can actually monitor how accurate things are, and you can measure things better. So the training becomes more actionable and meaningful, right? And then really, you know, using virtual training things instead of cadavers and other things, it actually helps, right? You can train more people, less required to do so. If you've not experienced or seen a mixed reality or a virtual reality training simulation of a body or of a heart or of a circulatory system or anything, you should try it. There's apps, I think, that might even be free. You can download if you have one of those $300 Oculus devices. You can buy them at Best Buy or Walgreens, anywhere, but it's really quite amazing, quite astonishing. And even I know for myself, as I've been gathering my own personal data, I have 3D imagery of my own MRIs, and can browse things around in a VR headset. It's amazing when it's your own data. I will tell you that. So then treatment, of course, there are places where VR and AR and mixed reality come into play for treatment. You know, one of the best use cases I can think of is for our aging population. You know, how do you create more meaning, more experience, more a relaxing environment? Well, I think a lot of these immersive experiences can help provide an environment that is conducive to you know, therapy and mood. And you know, imagine combining that with sensors that can monitor your alpha, beta, theta waves and your heart rate and your O2. And it's interesting. Even Hope, like if you talk to Hope here on the call, music, right, is so important and has much more of an impact than I think people even would imagine. So imagine now you take music to the next level, and it's now immersive, and you've got visuals and as part of that. So I think you'll see a lot of treatment come now with new emerging technologies and embedded in VR, plus with the sensors and data coming off of your sensors, so that you can tune that even better, right? I think personalization is really where it's at, right? This proactive, preventive, precision healthcare is the future of healthcare if you want to be relevant. You know, I guess a disgruntled person might say that you know, in the U.S. we really don't have healthcare; we have inefficient sick care, right? It's just not fair to say that, because wrong crowd to say that. But in reality, we do tend to treat sick people instead of help people stay healthy longer, right? And some of that's shifting the data from a reactive mode to proactive. And you know, this whole notion of chronic conditions. Think about you know, 90% of the expenses that we spend on healthcare is related to chronic conditions that can be avoided through early detection, or at least, you know, minimized or reduced. 35-year-old adults, you know, only 8% take preventative tests. And you know, even in companies, like I've worked for big companies, and they require you to go do your blood and other things, but so what? I mean, what's ever come of those? That's really been super helpful and meaningful for me? Not much. right? So, and I feel like I'm probably on the leading edge of being tested at this point for my own data. I'll show you here in a minute. But this whole notion of integrated diagnosis is something that if you step back and you look at what we're trying to do, that's the future of these data sets and how they go. And we haven't really been able to do it until now because everybody was so focused on their data set, their blood test, their thing. But imagine now you've got a data interoperability platform or capability where you can start to share and aggregate these things. You can actually start to be way more proactive and preventative and precise on the type of healthcare that you provide. And so this is just one example of an integrated diagnosis. And so let me get a little personal with you guys. I may be oversharing, and it's my data, so I guess I'll share. This is me. Like, see these pictures here. This is not out of a textbook. These are my scans, and I know for a fact that I'm probably not going to die of cancer in the next 10 years, and I know for a fact that I don't have a brain aneurysm. This picture in the bottom left is literally my veins in my head. And I have this as a 3D model. I can rotate around. Thanks for the compliment, Hope. My heart is there. I know that there's no visceral fat and that it's healthy and that the valves are operating properly. I know in my brain scan that my hippocampus is good. My Alzheimer's is, they're not likely to get it, for a while. I just turned 50, which is why I'm doing this for anyone that wants to know. But and what's interesting is, so you're seeing on the screen, these are my scans. And instead of it being black and white or what traditional MRI are, what this is showing, the coloration is actually machine learning and data science models applied to the scan. And it's time for colonoscopy. I actually did have that. I did not want to show my colon on the presentation, but I do have it, and I'm actually cancer-free. Thanks for asking, Adam. And I know way better than having the traditional test. Like, I know for a fact that there is no colon cancer in my future for a while. If you really want to see it, Adam, I'll show you later. But in any event, the data science that's applied to these images is quite amazing, quite astounding. You can take these raw MRI images, run it through a machine learning algorithm, and it automatically colorizes the things of items of importance. And it helps with the diagnosis. It helps identify items of interest. And in my consultation with my primary care physician, we were able to go right to the muscle groups, the fat zones, the brain. You can zoom in, you can zoom out. It's in 3D. These are things this is the future of healthcare, right? And especially when you start to apply all of these other data sets. So genomics is a big one, right? Every week, every month, you hear amazing outcomes from the data sets in genomics, right? And you're seeing an aggregate of 23andMe, these little startup companies, and they're all still kind of verticals, but you'll see it all come together under a common platform. That's when it's going to get really, really interesting. And, it was $3 billion to get your full genome scanned back in 2005. I just had mine done 3 months ago. I just got the results last week. It's amazing. You have the full data set now. I actually have on a memory stick my full genomic breakdown, and it's ever improving. As of June 1st, you may or may not have known it, but they actually didn't decode the full genome. It was 92%. They just figured out how to do the last 8% of all the areas that they claimed were not important. Well, I think we're going to find out there's more importance in those things as well. But if you've ever seen Gattaca, it's a potential. Like, once we get in here, you could being able to take your DNA sample and predict, what you're going to be, how tall you're going to be, what your predisposition for health outcomes are going to be. So, and Hope, you asked about how much the cost was. Well, so it was $3 billion in 2005. I think the one I got was about $1,000, but it's down to almost $100 if you want. You can find services that'll do that. I was looking for a little bit more complete version of it, but I mean, why wouldn't you go do it right now for $100? It's crazy, and it's really one of those scenarios where it's become an information system, and it's the compute power is got it down to where I think in the future everyone will want to do this. Now the interesting part is going to be, like, I have my own data set and I'm controlling it. It's not shared in a public space. Our trick is going to be how do we now create those digital twins, basically a digital twin of me in the data, and keep that so that it's there accessible and safe to those that I want access to it. And then, and of course, apply machine learning that I want to try to drive outcomes. So that whole data set scenarios is coming in the very near future. Actually, it's already here, but the cost is way down. And you actually, when you go do something like 23andMe with the coupon, I think it's $99. They have another $30 thing you can sign up for that actually does some proactive healthcare recommendations. So it's like cheap, and you should do it if you haven't. You should at least look at that. There's other services out there that are really good as well around nutrition that you can sign up for. Basically there's biohacking groups that are out there trying to figure out how to help with aging. I'm actually trying a few interesting things right now to extend healthcare, rebuild telomeres, doing something, just experimenting on my own data set to see over time how it's going to go. So every 3 months I go in and we'll get a whole nother battery of blood, MRI, health, DEXA, EKG, go down the list so that I kind of know what's working and what's not. Imagine if we all had that preventative and proactive capability based upon our healthcare system allowing for that, how much healthier we would be, how much more proactive and preventative we would be. I think I shared that stat that it's 1.5 trillion of cost to our GDP just based upon these chronic illnesses that I think we could predictively find, a great percentage of them. If you account for lost time of work and productivity, it's even higher. It's like a fifth of the GDP, somewhere around 4.5 trillion. So this is really, in my opinion, where healthcare needs to transform and into the future of healthcare, right? And what's cool, once you get these, you can start to do things like personalized vitamins. There's a service now where you can actually get your blood test done, and they will send you vitamins that are tuned to what you need, right? Versus just buying some off-the-shelf thing that who knows if it works, right? Sensors, like I feel bad every time my wife comes home from a breast exam. I mean, she's grumpy, she hates me. I don't know why, it wasn't me, but we don't need to be doing the same things that we've done before. This particular sensor here is one that's a non-invasive thing. It just is an RF sensor. It can detect anomalies, and you don't need to go into the horrific experience that you have to go to. So let's see. So in terms of sharing data with my healthcare provider, there's a question. So I actually went to a healthcare provider that is leading in this field. I'm one of 5,000 that's doing a kind of this holistic healthcare approach. So it's a special thing that I've opted into. I have not shared my personalized data with my healthcare provider. The last time I went to get a checkup, it was really kind of sad what that primary care provider was basing decisions upon. And I actually knew more about my health and what I should be doing than the healthcare provider. So I actually went to a different healthcare provider. But I think right now in that program, the way we're sharing my data is on a secure site. It has all of the scans and everything in chronological order with outcomes in the summary documents that I talk through with my primary care physician. So basically all the data, all the scans come in together into my data repository, and then we talk about it. And so another question, are the payers getting on board with the preventative possibilities? So right now I would say no. I would say that everybody's incented to take care of sick people versus help people before they become sick. And this is why this is a change, right? A lot of our ecosystems built up around making money off of sick people versus keeping people healthy. So it's going to be an interesting shift to see. I think that'll be part of the disruption, right? You're going to have to figure out how to be proactive and preventative, and without killing your business, right? So yeah. So let's see. I've got a couple questions here. Yeah. So right now, there's a question, how receptive are providers to receiving your personally generated data? I don't believe that, unless it's a specific provider that's in the program I'm in now, I don't quite know how I would share that yet. But that's why I think that slide that I shared back on the data interoperability, right? The more people that adopt this type of open standard for data exchange, the more we'll be able to share data and create those personalized, data-driven healthcare outcomes, right? Hopefully that helped, Julie, on your question. So another thing here too, you're going to see healthcare is going to be everywhere potentially, right? This is a picture I took at a CES trade show, and this is basically you go into a kiosk. It's telepresence. They've got all of the basics that you would need. You can do self-service. You can get help when you need it. They can order prescriptions. They can do all this thing just from this little kiosk. So it's not even a clinic you go into. It's just self-service with remote telepresence. So this is just one example of many, many that are out there internationally, right? And then you're going to see just a continuation of these sensors and devices that used to cost thousands of dollars and require a patient visit and do things, right? So this is one example of a wearable that I saw a few years ago. Of course, now the Apple Watch is doing this too, but they're coming out everywhere. You're gonna see this, and it's interesting to see even athletic companies and technology companies that normally you wouldn't even think about healthcare. They're starting to get into the game because of that disruption. So it looks like we had 10 minutes, we're at the 9 or 8 minute mark. Sorry. Hope, I want to give you some time to end. I can ramble on forever, and if anybody has any topic that you want to dive in on, again, I'm a technologist. I don't only do healthcare. I like to take all industries, all technologies, and pull them in and innovate the adjacent possible, whether it's a customer experience thing, an operational efficiency, a data-driven outcome, or AI. Happy to help with any of those topics or conversations that you may have. So, Hope, let me turn it over to you for just a minute, or any other questions.
I am here, but nobody can hear me.
I hear you.
Oh, you do? Okay. Well, one, I want to say you're brilliant. Inside and out, you look brilliant, but that was an excellent presentation, and everybody is incredibly grateful, Brandon, for your insights and the excitement and passion, because in this heavy lift we are all in right now, I know one of the questions we posed to you as a speaker was, what are the best practices and things to keep feeding hope to get the technology under healthcare providers so they're able to spend more time with the patients and improve those outcomes versus technology being a barrier. And I think you gave a lot of excellent ideas. One of the things that came to mind I wanted to ask you was, a lot of the leading technologies are upstream solutions that we got to see today. Can you talk about the adoption curve between upstream technology solutions that you presented versus the downstream, that's the acute care when we're in ICU, versus like 90% of chronic conditions? If we did what you just said, upstream, we'd be saving ourselves a whole lot of woe. But what's the difference in the adoption curve, and what best practices or insights do you have to help this adoption curve even out more? Because it seems like it's heavily biased to upstream versus acute.
Yeah, this is a tough nut to crack, right? Because there's a lot of money behind all of these things, and it's hard to disrupt these big money brokers, the power brokers, if you will. How do you get the adoption going more? I think it's going to just happen because people will start using them, because they'll see that the outcomes are so beneficial that it'll be like you'll be in a bad spot if you don't adopt some of these, right? Some of these outcomes with longevity and health. I think people I'm almost feeling a movement right now, a wave starting to where you start to address things earlier. And as the cost of these things come down to where anybody, like my dream would be, and I'm even thinking about this, should I go jump in both feet and help create a platform for interoperability so that every person can sign up for, the cost of your cable bill and have this type of proactive insight into your healthcare. And so I think, that's going to help with adoption. You need these big players will come. Look, Amazon will do it. Like they'll make it to where it's part of Prime. Who knows? Imagine they already did music and TV and delivery, and prescriptions are now free to deliver. So what's the next thing they want to go disrupt? Well, and then how does that impact then the chronic caregivers? Hopefully it'll help because they'll have better data. They'll have access to that data set, and it'll be more tuned instead of trying to figure it out on the spot. They'll come in with some really good actionable data. But I will say, most of the hospital systems that I work with, we're doing just basic blocking and tackling right now. It's like legacy applications, moving them either to a public cloud or to take advantage of native cloud services, get the data in a format that you can use. I mean, it's almost like it's just overwhelming when you think about it, right? For a lot of IT groups and teams. So you have to figure out how to keep the run going while still innovating. And it's a big one. It's a big nut to crack.
It is, and it's exciting to have so many brilliant minds passionately committed to that. And I think that's one of the exciting things about being a HIMSS member, is you get to come and align with that. There's a question from Hank Jones in Houston, and he's hoping you could type in the chat or just say what HIT books you recommend for future-focused folks in healthcare. Thank you for that question, Hank.
Yeah. Interesting. There's a couple of good ones. It depends how deep you want to go and what topic it is. There's the if you want to read about disruption and some of the things that are coming, there's kind of how to prepare for the disruption. And then I think anything you do with data and AI is going to be really big and important. So offline, I'll try to put together a list of a couple that will be good and useful. It kind of depends too on what your passion and focus is. So at the end of the day, you're just going to have to kind of lean in with what you're good at and figure out how to extend that into the future of what's coming. So that's a great question. Let me try to put that together.
And Brandon, if you wouldn't mind just sharing your contact info, that Hank could follow up with that, or anybody else that is looking for those books. We see a lot of great comments here and questions. It's been amazing. Again, Brandon, you've been an absolute jewel to prepare this discussion and presentation, and we're thrilled to have you as part of our HIT family and community. One of the things I want to shout out to everybody is that next month in September, we were going to have our first in-person lunch and learn. Due to the stage 5 announcement and due to the spread of COVID and the Delta variant, the board will be discussing that, and we will make that announcement very soon within the next few days. So today was a brilliant presentation. Again, thank you, Brandon. That was exciting and wonderful. Next month, we are going to have HIT security panel, and with the working title, Carrying an Umbrella When the Sky is Falling. Amongst when healthcare is under so much crisis and disruption, it's ripe for security breaches. So we're excited to have those panelists next month, and that will be Wayman Cummings, Jeremy Kelly, Charles Henderson, and Abby Ross as the moderator. So everybody look forward to that. I want to give a personal shout out to Roland Granger, who is our backstage host working diligently. And thank you again to our sponsors, which are Pure Storage and Sirius Healthcare. You guys stay well out there, and thank you everybody for making this such a successful day. Take care. Bye-bye.
Have fun at the conference. Bye, everybody.